Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be talking about a treatment plan for the condition fibromyalgia. Okay? So, the definition of fibromyalgia, it is a painful non-articular rheumatic condition of at least 3 months duration, characterized by widespread muscular achiness and specifically the palpation of tender points at 11 of 18 prescribed locations on the body. Okay, so you're gonna be assessing for at least 11 tender points in the body out of the 18 prescribed locations. Okay, so it is a systemic disorder pertaining to body system, like inside the body, that affects an estimated 2 to 6% of the adult population. Okay, it affects 2 to 6% adult population. Okay, there is no obvious origin of the pain. Here you go, guys. It affects points above and below the waist, including the low back, shoulders, including the trapezius muscle. Okay, the muscle that is located on the middle, the neck and the mid back. Okay, the trapezius muscle, the neck, the back of the head, the upper chest, the arms, hands, thighs, and legs. So it's all over. Other areas such as the temporomandibular region, by the side of your face, and anterior chest may also be affected. Okay, it is a group of signs and symptoms that include chronic pain. So it's been there. The pain has been there for a long time, like chronic pain in muscles. Okay, muscle pain for a long time, tendons, ligaments, and other soft tissues. Okay, here you go, guys. It is frequently seen in chronic fatigue syndrome. So if a client has chronic fatigue syndrome condition, it will be, you will be assessing fibromyalgia condition as well. Okay, irritable bowel syndrome, yes, migraine headaches, okay, sleep disorders, and several other chronic disorders. Okay, approximately 4 women are affected for every man. Okay, can occur at any age, even in children and the elderly. Okay, so here you go, guys. It can affect children and elderly at any age. Okay, it can affect, right? So other conditions associated with fibromyalgia include premenstrual syndrome, depression, chronic headaches, migraine, insomnia, temporomandibular joint dysfunction, the TMJ dysfunction, myofascial pain syndrome, irritable bowel and irritable bladder syndromes, and chronic fatigue syndromes. Okay, so take note of these conditions, guys. If a client has this condition, then fibromyalgia condition is present. Okay, so this is fibromyalgia condition, the definition. Causes of this condition. So the causes are not clear, but there seem to be connections with immune abnormalities and a genetic predisposition which causes neuroendocrine dysfunction, the nerve and endocrine system dysfunction. Now, there is some evidence of a deficiency of serotonin due to abnormalities of serotonin binding to platelets. Okay, this results in a negative effect on the pain inhibitory pathways of the nervous system. Okay, so it involves the nervous system, guys. Okay, for symptoms, there are a few symptoms here. Just take a look at this. For the part 2 of the treatment plan, which is the subjective component, now you're going to find the health history question. So these are some of the questions that you can ask your client. Include this in your treatment plan for this condition. So how is the client's general health? First and foremost, okay, you're going to ask your client. So has fibromyalgia been diagnosed by a physician? Okay, you're going to ask this question to the client. What method of diagnosis was used? Okay, the methods used were specific tender points palpated throughout the body. So you're asking for specific tender points during the assessment, the palpation. Now, what other symptoms are experienced? So you're going to ask for other symptoms to the client. Now, has the client received massage since the diagnosis? It's very important. So you're going to ask the client if the client has a massage already after the client has been diagnosed. Okay, how did the client respond? Okay, so you're going to ask this to the client as well. Was post-treatment soreness experience? So after treatment soreness, if the client experienced this, then you're going to ask, what other therapist has the client tried or is currently having? So you're going to ask the client of other therapists, if the client is seeing a physiotherapist or a chiropractor or other therapists, okay? How did the client respond? Okay, going to ask this question as well. What is the client's activity level? Okay, it's very important. Is the client taking any medication for pain, depression, or sleep disturbance? Okay, it's very important to ask this question regarding medication. Okay, guys? Now, let's move on to part 3, which is the objective component. Now, you're going to do assessment on this level. So you're going to do observation, like the postural assessment. So you're going to do a postural assessment on which is performed on this for this condition. Now, for the postural assessment, you're going to be looking for antalgic postures, which are often evident. Okay, so for fibromyalgia and hyperkyphosis with head forward posture may be observed. Hyperkyphosis is like an outward curve at the mid back. Okay, you're gonna see this. Okay, there may be an imbalance of the anterior tilt of the pelvis. There's an anterior tilt of the pelvis, like the hip area. Okay, apical or paradoxical breathing patterns may be observed. Okay, so the breathing, there's abnormality. Pain is present bilaterally on palpation. Now, when you palpate on both sides, the client will have pain. Okay, above and below the waist. Okay, so the waist area, above and below on both sides, there's gonna be pain when you do the palpation. Now, trigger points are palpated. So painful points are palpated. These should not be confused with tender points. Okay, so tender points are different from trigger points. Trigger points are the area is painful, but there you're gonna be, palpating, like there will be nuts on the tissue. Okay, a little hard tissue. For tender points, there will be you're gonna only feel or palpate, the area with pain, just pain. Okay, that's the difference. So for the palpation, you're gonna do the differential assessment for fibromyalgia is that palpation of the tender points that causes pain local to the area palpated. Okay, tender points. Like I said, only pain. There's no knot on the tissue, or there's no hard tissue on the area. Unlike myofascial trigger points, there are no referral patterns of pain or taut bands like knot or hard tissue present with fibromyalgia tender points. So it's only like, more on pain, tender pain areas. There's no referral pain like trigger points. Okay, that's what you're gonna be looking at. Okay, for testing, active free range of motion (AFROM) may result in reduced ranges in affected areas due to pain and weakness of the muscle crossing the joints. So when you do active free range of motion, you're gonna find this result. Active resisted strength testing may result in pain and weakness in affected muscle. Okay, so when you do this testing, you'll have these results. Okay, it's very important to note down the contraindications and precautions in treating this condition. Okay, so fibromyalgia indicates massage. So meaning any client with fibromyalgia diagnosis, it is okay to massage the client, but there should be care. So care must be taken not to overtreat. Okay, so however, because clients are extremely sensitive to pain and may have accumulations of waste products in the tissues that are difficult to flush out adequately. So you should be careful. You should take a lot of care in doing treatment for this client. Fibromyalgia contraindicates the use of ice or ice massage. Here you go, guys. Any kind of cold can exacerbate symptoms. Okay, so don't use any cold treatment for patients with fibromyalgia. Exacerbate may increase. Okay, avoid very deep work or techniques that overstretch the client's muscle. No deep work or techniques. Deep or invasive techniques will frequently result in increased pain after treatment, post-treatment. Okay, so no hard massage. Okay, treatment should not be so long and vigorous as to fatigue the client. Okay, not so long. Just do the treatment for a short while. Not vigorous. Okay, not to fatigue the client. Massage over 1 hour duration should be avoided. There you go, guys. Avoid over 1 hour treatment. Frequently, muscle relaxants, analgesics, and antidepressants will be prescribed to help the client cope with the symptoms. So these are the medications that can be prescribed. You're gonna refer to the family physician for your client having this condition for these medications, okay, to help them. Techniques should be modified accordingly. Okay, so based on the client's pain tolerance during the treatment, you should modify your techniques or your treatment. Okay, guys, take note of this. Now, moving on to part 4, which is the treatment plan. You should follow these goals. Okay, so there's to reduce sympathetic nervous system fire, which is your fight and flight response. And there's reduced fascial restrictions, hypertonicity, trigger points. Fascial restrictions are superficial. Okay, it's the fascia below the skin, and the fascia covering the muscle should be, treated, should be reduced. Hypertonicity, tightness of the muscle, and trigger points, the area where you can feel knot on the tissue, a little bit of, hard tissue with pain and referral. Peripheral pain, it refers to other parts of the body. Okay, trigger points. Now, to decrease pain, of course, maintain range of motion, meaning maintain movements on the joints, the affected joints. Increase local circulation, so locally, the affected area, to increase blood circulation and lymph circulation. Okay, treat compensatory structures. Compensatory, those structures that are indirectly affected by the condition, but they are the ones doing the movements for the affected tissues or muscles. Okay, so for the positioning, pillowing, and draping. So positioning and pillowing are for comfort only. Okay, so prone, you can do prone, face down, side lying on the side, or supine, face up. It will be possible. Okay. So for the techniques, you can do deep tissue massage, lymphatic drainage, PNF, MET stretching, and Swedish massage. Okay, so you can do all these techniques, guys. For the hydrotherapy, you can do pre-treatment hydrotherapy of heat is applied for a generally relaxing effect. So before treatment, hydrotherapy of heat, okay? Warm application on the area to relax the muscles, relax the area. Now, cold hydrotherapy is appropriate in areas experiencing acute tenderness. So for acute, as usual, acute pain on the area, you're gonna use cold hydrotherapy or cold compress, ice pack, or cold pack. Okay. Now, for the general treatment, initially you're gonna do the treatment for half an hour in duration to avoid exhausting or fatiguing the client and overworking the client. Okay, so just half an hour, guys. Okay, for specific treatment, the treatment is in the context of a relaxation massage, including enforced diaphragmatic breathing. You're gonna ask the client to take a deep breath in and out while doing the treatment. Okay, and there are other specific treatments. Just read on this, guys. Take a look at this. More. Just read on this. Let's move on to the part 5 of the treatment plan, which is self-care plan. Now we have goals. It's to educate the client. So you're gonna teach your client what the client needs to do at home. Okay, for remedial exercises, or you can teach a client for strengthening exercises or stretching exercises, and you're gonna refer the client if there's a need to refer the clients to other practitioners, such as a physiotherapist or a chiropractor, or to the family physician. Okay, now you need also to promote an exercise regime. Like I said a while ago, encourage relaxation. It's very important. Okay, so you have to tell your clients to relax, to do more of relaxation at home. Okay, now for self-care, okay, just take a look or read this information, guys. More information. Now let's move on to part 6, which is the treatment frequency and expected outcomes. So shorter, more frequent treatments are ideal, okay, guys, for this condition, with 2 to 3 half-hour massages per week. So three massages per week for only half an hour. Okay, this may not be practical for the client. Therefore, if the client feels no ill effects from a short treatment, the time can be extended to 1 hour, okay, once a week. There you go. Okay, so regularity of treatment is important for more lasting benefits. So it has to be regular. If you're gonna do an hour, should be once a week regularly, okay? Or 3 times a week for half an hour. Depends on what the client wants, okay? Now, no two clients will respond the same, so the treatment must be tailored to the individual. Okay, so your treatment must be based on the, you know, how the client will respond. Each client's response for the treatment of this condition. Okay, so here you go, guys. That ends our video for this condition, treatment plan for condition fibromyalgia. Thank you for watching my video. And please subscribe, like, comment, and share my video. And again, thank you so much for watching, and you have a great day.